Hello, everyone. It's March 17th, St. Patrick's Day, and I wish everybody a happy St. Patrick's Day. To be perfectly honest, I completely forgot, and I don't have any green on, from a standpoint while I've got some gold and blue blood, I've got a bunch of green blood in me, from the standpoint of Marshall, so I'll just hide behind that for right now, but again, I really just didn't even realize that it was St. Patrick's Day. It's just so many things, to think about, and so many things to be grateful about, and so many things to be prayerful about. But today is the anniversary of our first COVID case, and I think I've got a little video. I just watched it for the first time about 5 minutes ago, and but anyway, it surely brings back a lot of tough days for all of us, but I think you'll like it. I think so. Today I've got to tell you just this: we've got 34 additional deaths since my last briefing on Monday, and I can tell you that we got to be smart here. We got to be really cautious. All across America, we're starting to see this thing heat back up in some different areas. It's not time for high alert, but at the same time, we absolutely have made the right decision about continuing to wear a mask and not just jump especially not jump to do something, to make a political statement or a macho move or whatever like that, but we have lost 34 people. This thing is ticking up just a little bit in West Virginia, but it's ticking up more so all across our nation in about, I think it's almost half of our states that we've seen a little uptick, and so we got to be cautious. We're really close to whipping this thing, but if we don't watch out, we're going to end up sliding back down. We've got to be careful. 34 people today. Our 2,532nd death is an 81-year-old male from Jackson County. Our 2,533rd death is a 64-year-old female from Lincoln County. Our 2,534th death is a 68-year-old female from Logan County. Our 2,535th death is an 85-year-old male from Boone County. Our 2,536th death is a 53-year-old male from Lincoln County. Our 2,537th death is a 53-year-old female from Cabell County. Our 2,538th death is an 81-year-old male from Marion County. Our 2,539th death is a 64-year-old male from Kanawha County. Our 2,540th death is a 71-year-old female from Wayne County. Our 2,541st death is a 79-year-old female from Wood County. Our 2,542nd death is a 71-year-old male from Preston County. Our 2,543rd death is an 80-year-old male from Wood County. Our 2,544th death is an 80-year-old male from Cabell County. Our 2,545th death is a 69-year-old female from Logan County. Our 2,546th death is a 74-year-old female from Boone County. Our 2,547th death is a 90-year-old female from Morgan County. Our 2,548th death is a 59-year-old male from Brooke County. Our 2,549th death is a 72-year-old male from Cabell County. Our 2,550th death is an 83-year-old male from Berkeley County. Our 2,551st death is a 78-year-old male from Berkeley County. Our 2,552nd death is a 64-year-old male from Nicholas County. Our 2,553rd death is a 52-year-old female from Kanawha County. Our 2,554th death is a 74-year-old male from Wetzel County. Our 2,555th death is a 73-year-old male from Kanawha County. Our 2,556th death is a 76-year-old female from Berkeley County. Our 2,557th death is a 67-year-old male from Berkeley County. Our 2,558th death is a 74-year-old male from Berkeley County. Our 2,559th death is a 63-year-old female from Cabell County. Our 2,560th death is a 72-year-old male from Brooke County. Our 2,561st death is an 81-year-old male from Hampshire County. Our 2,562nd death is a 79-year-old male from Berkeley County. Our 2,563rd death is an 83-year-old female from Kanawha County. Our 2,564th death is an 86-year-old female from Hampshire County. And our 2,565th death in the state of West Virginia. 2,565 people we've lost is an 83-year-old female from Berkeley County. Now, West Virginia, you got to listen to me. This thing can tick back up. The sun's shining. A lot of people are getting vaccinated. You've got to be careful. You've got to be careful. Wear your mask for just a little while longer. Get vaccinated. Everybody has got to get vaccinated. And as we keep pulling the age down and we keep expanding those that are eligible, absolutely, please go get vaccinated. 2,565 deaths. It's amazing. It is absolutely terrible. And from that, how much have we lost? Think about all the wisdom that we've lost. Please, please don't let these people just become a number. Please just don't become numb to this. These people hear your prayers. They need you. And all their loved ones need you. So please, just keep them in your thoughts and prayers. They really need you. Our numbers, we've had 315 new positive cases in the last 24 hours, and we tested a lot of people, and our positivity rate's good at 2.90. Our cumulative rate dropped down a little bit more at 5.13. Our active cases are 5,206. That's probably up just a little teeny bit, like 100 more. We have recovered cases of 128,563. We now have almost 200 people hospitalized again. We've jumped up, from around 150 to 190. We have 70 people in the ICU units. That's up a little bit. And here's something that we really need to pay close attention to. We now have a red county back in West Virginia. Hardy County is back in the red. This thing's tough, and it's not going to go away easy. If you're 65 and older and you get that sniffle or you get that headache or tiredness or whatever it may be, please go get tested. It's free, it's painless, and if we can, pick this up in the early stages, we can get you the antibodies and save your life. Just go get tested. It just take a few minutes, and please don't let this linger on. And then, absolutely, when you're tested, it's too late for the antibodies to do you any good, and you're in a world of trouble. Our vaccination success is, through the last several weeks, our deaths have dropped in excess of 80%. We have seen a drop in hospitalizations to get us under 200. Like I said just a second ago, that's bouncing back up. By the end of this week, we will have vaccinated all of our school employees over the age of 50, and that's great. As of today, we have vaccinated 58% of our West Virginians that are over 65 years of age. Our goal is to get 75. That's not my goal. My goal is to get absolutely significantly higher than 75, but I've got to have you willing to get vaccinated. Our administration rate on first and second doses is 98.2% right now. Goal is always above 100. We have now vaccinated in West Virginia 644,173 people. That's good. Those are first round and second round shots. We've really done second round shots of 247,000. So that 247,000 truly represents exactly how many have had first and second round shots. You know, on Wednesday, I expanded the list of pre-existing medical conditions to be eligible to receive the COVID vaccine. We also began vaccinating all essential workers of all ages, so that's good. The vaccine scheduling system, all West Virginians aged 16 and above can pre-register to get their vaccine through our scheduling system, and it takes less than 10 minutes to do so. If you've got a problem with that, like I've said before, if you can contact us, we'll walk you through the process and get you registered. As far as saving our wisdom clinics, all 55 counties up and going. You know, you got to watch all and any weather notice, alerts, and we will continue to prioritize those 65 and above, but we've dropped that down to 50, but we're still looking, for the people that are 65 and above to move them to the front of the lines. We've now put in arms 215,520 individual shots to people that are 65 years and older. That is really, really good. We've got second round shots in those people's arms of 136,650. Those people we know are the people that this disease targets, and we've saved a bunch of lives right there. The COVID vaccine info line is up, and you got all that. Vaccine reminders, you got to get your vaccine. I mean, that's just all there is to it. This thing, like I say every day, about people scaring you about getting this vaccine, or maybe I don't have to take the vaccine now because everybody around me has got the vaccine and I'm good to not take it. Now just think about that. Think about just what you just said. The overwhelming majority of people around you, we're nowhere close to that. But if we were, even if we were, so therefore I'm not going to take the vaccine. If you're thinking that way, just think about just this. I mean, are you still not exposed? Do you still not run an incredible risk? Well, you do. You absolutely do. So come on. Everything that we know about this vaccine is all positive. Even from the standpoint, if you were to have the vaccine and be able to some way, somehow, still get COVID, your chance of being hospitalized or your chance of dying absolutely almost becomes zero. So please go get the vaccine. From the standpoint of Thomas Health, we thank them in every way. They're a surge facility that is at St. Francis Hospital. We absolutely, let me go back. Thomas Health is announcing that our surge hospital and everything that is the facility at St. Francis, that we are now closing that because we just don't have any patients for a need for it right now. I want to personally thank, the Thomas Health people for serving our state during one of the most difficult years in healthcare history of this state. Now, if we have to stand it back up, we'll stand it back up, but let's hope and pray we're on a downhill slide. I caution you, though, I caution you, don't go to sleep at the switch. One robin doesn't make spring, and so absolutely we know this thing can whip back on us. We got to be really careful. About all of our free testing map, take advantage of it. It's free. If you have any level of anxiety or whatever it may be about this, go get a test. We especially thank Walgreens and Frith again and again and again for all the good work that they've done with our drive-through testing. We now have 2 outbreaks in our long-term care facilities. Now this one is not good right here. We have 7 outbreaks in our church community, and that's in 5 counties. That's in Webster, Fayette, Monongahela, Raleigh, and Nicholas counties. Our church community has done so good. We all know the church is a place of all places and everything that can really cause an issue because we're singing, we're probably embracing, from the standpoint of please wear your mask. Please just hold up just a little while. If you happen to be one of the elderly and everything, just hold up just a little while. But if you decide to go to church, please keep that pew in between you and wear your mask. And absolutely, just protect yourself. Use really good sense. We don't want this thing to become whiplashing back on you or anyone. Please use really, really good sense. Corrections numbers are better and better. We only have 28 inmates and 8 staff, that are having this problem right now. 24 of them are at North Central, and there are 3 inmate cases at the Western Jail, and that's down from 10 on Monday. All that's good stuff, but at the same time, I am always concerned that this thing is just starting to tick back up across this nation. And if that be the case, it's absolutely going to jump on us as well. All the guidelines are up there. I tell you over and over about the face coverings, to wear your mask. Please wear your mask. And, if you're out in a public building and everything, this thing has not gone. It is not gone. We have to learn how to live with it. We're doing that as best we possibly can. We've got most everything open back up. Like I said, the sun's shining. And absolutely the number of people that are vaccinated, when I've said over and over, we've got to bridge ourselves to this vaccine. Well, we've gotten to the vaccine. We're going to be opening it up more and more and more to be able to vaccinate more and more people as we get more supply, and we will get more supply, but we've got to be really careful. We've got to be careful for just a little while longer. Last thing I got is give blood. Absolutely, you can save a life. And especially, I believe, at least in my world, that you owe consideration to giving blood if you have recovered from this dreaded disease and the good Lord above has blessed you. Please, if you can do it, please consider giving blood. Nevertheless, that's all I got right now. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. In keeping with the comments the governor has given us, I want to focus my comments today on us looking at different places to get an insight onto what may be happening around the world and how this might affect us in the United States and in West Virginia. So in Europe, which was the place that really saw the COVID-19 impact before we did, they are seeing a third surge. And in Germany and Italy, they're seeing not only people dying of COVID-19 again, cases starting to go up, but also they're seeing that because the variant viruses, particularly the United Kingdom variant virus, tends to be spreading very quickly, that younger people are getting more severely ill than they had seen before and ending up in hospitals. I think it's really important for us to recognize, though, that the country that is really doing the best in vaccination of the population, which is Israel, is starting to see a protection against that. And particularly in their older population, they have targeted their older population much in the way that we have fashioned our strategy. And we know that these vaccines, all 3 vaccines, the Pfizer vaccine is the one being most used in Israel, are all effective, completely effective in reducing deaths and reducing hospitalizations in people who finish all the doses of the vaccines and are 14 days out from the last dose, and that's from the clinical trial data. But it really does reinforce what the governor said, that West Virginia, we are not out of the woods yet. We have made dramatic and really important progress, and we thank all the people responsible for that and the governor's leadership. But we also know that we are at risk of seeing more spread. It is concerning that we are seeing our hospital numbers tick up, as the governor said. We have heard about more deaths this week than we have in the previous few weeks. And because of that, it really does give us reason to want to make sure that we are really emphasizing and asking all West Virginians, and particularly our younger folks, the 20 to 40-year-olds, and even our 10 to 19-year-olds, to make sure that as you're out with your friends or you're at social gatherings or you're moving around, presuming that many people in these categories have not been vaccinated yet, that you be very, very careful about wearing masks and staying physically distanced. We know that the threat for the US is just like we're seeing in Europe. And we also know that there's states that are becoming much more aggressive about stopping mask mandates, and these states have not fully vaccinated either. So we will watch other states in the country to see what happens. But the key is for us that if we can protect ourselves and protect each other during this really critical time period, and continue to vaccinate and to have our citizens, particularly our most vulnerable citizens, choose to take the vaccine, then we hope that we could be more like Israel than right now like Italy or Germany that are really seeing these problems. The other thing that I wanted to bring up is that we are learning more and more about the virus and vaccinations all the time. And one really important study that got reported from Israel was that pregnant moms that got vaccinated were able to give their infants as they were born the protection, antibodies, immune responsiveness against the vaccine. And although we don't see a tremendous number of infections in infants and really young children, it is important to recognize that the passive immunity that moms give their babies also is at work in pregnant moms that get vaccinated. So West Virginia, be very cautious right now. This is a critical time for us. Please wear your mask and stay physically distanced and be smart as you've done the whole time. And please, if you have that opportunity to get vaccinated, please choose to do so. It will save a life, and it may very well save your life. Thank you.
Thank you, Dr. Marsh. Now let's go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. Just want to highlight some of the additional initiatives that are going on as we enter a new phase of creating parallel paths to deliver vaccines to our population and get shots in the correct arms, as the governor's tasked us to do. This week, we have mobile clinics that are working with some of our critical workforce employers, to include retailers, manufacturers, and others. We're also going to work to open up those clinics to family members, or particularly spouses of those critical workers in the appropriate age categories and categories that we've listed out. Working with BOAD again on another, along with the Council of Churches and Benedum Foundation, on another effort this week to get to grandparents, particularly grandparents who are the primary provider for some of our children in our state. We also are working an initiative in the Eastern Panhandle with West Virginia University Medicine and Health System and Shenandoah Federally Qualified Health Clinic to get to populations. An example of why we're doing that, those two entities serve 95% of the population for medical needs in the Eastern Panhandle. So they're a great outlet for us to get additional people who either won't sign up centrally or may need a little bit of motivation from their primary care providers or their medical providers to get the vaccine. We have an effort going on this week to reach out to 2,400 homebound West Virginia citizens, as well as working on some of our homeless population around the state of West Virginia. So a lot of continued efforts going on. The governor continues to press us each day to make sure we get shots in the correct arms and the flow of vaccines continue to open up. And that is why we are going into this next phase of creating parallel paths to get to the vaccine. While we're doing that, we are also cognizant that there are still people out there in the age category over 65 that may have not gotten to a vaccine. So I continue to encourage folks, if you are in that age group, call the hotline. We take those lists that come into the hotline, we deliver those to each county based on the individual's location, and work with those counties through a variety of resources to call, to send emails, to send letters, and to make sure we get to all of our population. Thank you.
Thank you, sir. Next, we'll go to Dr. Ayn Amjad, our state health officer.
Good morning. Just to reinforce what Clay did mention, we do have available testing sites throughout the state that are free. We do encourage you to visit these sites. We are seeing a slight increase in our hospitalization rates across the state. While they're not alarming at this time, we do encourage you to get tested way before you're seeing any symptoms that would cause you to be really sick. So if you're not sure and you're having some symptoms of allergies or even a sore throat, we do have these testing sites that are available and they are still free. So we do encourage you to do that. We also still have a lot of registration that you can go online and sign up. So we'd like you to do that as well. The sites have been opened up and those are available to view on our website as well. We also still like you to wear your masks when you're indoors and encourage you to do that as well. But that's all I have for right now. Thanks.
Thank you, Doctor. Next to Secretary Bill Crouch with the DHHR. Secretary, your mic is still muted.
Sorry about that. I apologize. Good morning, everyone. I want to thank everyone again for their patience with regard to the system, scheduling system and the registration system. We still need individuals, as the governor says, in some counties to register for the vaccination. We're pushing very hard to make sure everyone that's eligible gets vaccinated. We've had questions with regard to the request that individuals who have been on the system for more than 3 weeks contact the call center. We are pushing those lists out to the counties so that the individuals in the counties who are doing that scheduling have that information and can contact those folks. We directed them to contact individuals that have been on the list for more than 3 weeks. We still have thousands of individuals in there, around 7,000, a little over 7,000 individuals, 80 and over. We have about 23,000 individuals age 70 and over, and 18,000 individuals between 65 and 69. So again, we're working through those lists and trying to get individuals into those clinics as quickly as possible. We've expanded the individuals who are eligible. That information is on the website. We've had a lot of questions regarding who is eligible. That information is on the DHHR website that folks can look at and make that determination. So again, we thank everyone for their patience. I also want to quickly thank, as the governor said, St. Francis Hospital. Dan Laufer and his folks did a terrific job. The governor directed us to stand up Thomas as a surge facility to make sure the citizens of this state had access to acute care services, and they did. We went through that surge well. I want to thank our acute care hospital, the healthcare system out there for what they've done through this surge. As the governor said, we're not through this yet. Please wear your mask. Please get vaccinated. Thank you.
Thank you, Secretary. Next, we have a video to commemorate the anniversary of the first case of COVID-19 in West Virginia 1 year ago today.
Just moments before I was able to come on tonight and talk with you, our health officials came to me and said, now we do have our first positive confirmed.
West Virginia is reporting its first confirmed case of coronavirus. Governor Jim Justice is reassuring people here in West Virginia that the preventative measures are necessary here.
For over a year, Governor Jim Justice's top priority has been guiding West Virginia through the COVID-19 pandemic, with the setup of an informational website for the public, regular press briefings, and prayers.
But Father, I pray for all of us in our great state that you will intervene now and hear our words, as I know you will, and some way, somehow intervene to stop this terrible virus.
And after having to shut down some activities across the state, Governor Justice developed a plan he named West Virginia Strong, the comeback.
We've come up with a methodology that we think will move us forward with science and math behind it, and experts behind it, and leadership behind it.
Under the governor's leadership, West Virginia has been among the most successful states in the nation at minimizing the spread of COVID-19 through aggressive testing.
How do we really find out exactly where the problems are and what to do? We test. We test. The more we test, the more we know.
This program has allowed easy access for citizens to get tested at various locations across the state every day. West Virginia was the first state to order that all residents and staff members at every nursing home and assisted living facility in the state be tested for COVID-19. The CDC later recommended that all states across the country should replicate this strategy.
We ran to the fire. I commend all those that pulled that off and everything, and it's a good thing. So I'm proud of you, West Virginia.
Under the governor's direction, all counties made in-person and remote learning options available for the 2020-2021 school year, establishing over 1,000 Wi-Fi sites.
All 55 counties, there'll be all the K through 12 schools will have it to where you can go to the parking lot there and do whatever and get on the internet.
And 500 feeding sites that have provided millions of meals to kids. The governor and state leaders created a color-coded county map for schools determining protocol for each county.
And each county in our state will receive a code, basically either a green, yellow, orange, or red code that will change daily.
West Virginia has been praised on a national level for our coronavirus response.
We turn now to West Virginia, one of the states lifting restrictions and opening businesses at full capacity.
When it comes to COVID-19 vaccines, you are not only leading the nation, but leading the world.
What are you doing that maybe other states can copy to get, as soon as they come off the plane or they come off the truck, they're in an arm?
Well, West Virginia's done a great job.
You have been lauded for success in getting vaccination out to your people. It's about 18% of the state, I believe, that's been vaccinated.
The governor managed the allocation of the state's $1.25 billion allotment of federal CARES Act funding. He also provided hero pay to first responders and frontline workers.
We're going to give the counties an incredible amount of latitude to reward the people that are the true first responders, the people that are the true soldiers right on the front lines.
Under the governor's leadership, West Virginia ended fiscal year 2020 with a surplus, despite the effects COVID-19 had on the state's economy.
That in itself may be the biggest accomplishment that we've ever pulled off.
And had recorded surpluses in 7 of the 8 months so far in fiscal year 2021.
We're now at $131.7 million of surplus, and I could go on and on and on about it.
And now West Virginia has led the nation in the rate of COVID-19 vaccine distribution and administration.
Well, in this situation with this disease, there's 3 ways to stop it. There's 3 ways to combat this. And that has to come down to age.
Vaccinations have been provided to every long-term care facility in the state, while some other states haven't even started. 2.5 weeks after the vaccine arrived in the state, the vaccination rate ranked as the highest of any state in the nation.
And we're pushing it out the door just as fast as we possibly can. Get absolutely vaccinated. That's all there is to it. It's just as simple as that.
Governor Justice placed importance on our elderly population in his Save Our Wisdom program to ensure those residents are vaccinated quickly.
But it is absolutely targeted at our people that are 80 and above, and our faculty and our service personnel 50 and above.
In January, Governor Justice and DHHR launched a registration website so West Virginians can be notified when it's their turn for a vaccine. And he made vaccine clinics available in all 55 counties. Now, more than 12% of the state's population is fully vaccinated.
Those people, not long ago, 6 weeks ago, thought that there was no chance that they were going to be able to get a shot until maybe April. We've got well over half of our total population in this state that's above 65 years of age and older, that have gotten shots. And they're protected. And a bunch of lives have been saved right there.
Earlier this month, as the one-year anniversary approached, Governor Justice began loosening restrictions, expanding capacity and limits at restaurants and businesses all across the state.
Just be really considerate of all, and we'll get there. I am extremely respectful of all of our freedoms, but this has been one tough go of it, has it not?
All right, we'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon or good morning, Governor and staff and fellow reporters. I have a two-part question here. I did notice a slight spike this morning. I don't want to make, over-exaggerate it, but 315 new cases is a spike, 19 new cases since yesterday, 34 since Monday. That's a spike. Hospitalizations are up by about 50 patients. I'm wondering if anybody has thoughts on why we're seeing this slight uptick and your concerns about it. And the other part of my question is, I, like many people, got my first vaccine shot at Walgreens, and now Walgreens is leaving the state system. A lot of us have not had our second shots yet. What's the plan in place to notify people who got their first shot at Walgreens but still haven't got their second?
Okay, Clay, I think maybe if you, Dr. Marshall, would answer the first part, and then General Hoyer, you've got to jump in on the second part.
Well, thank you, Governor, and thank you, Mark. We know that this pandemic has had a very unusual way of unfolding to cause the problems that we would have never predicted at the beginning. So as we go forward, we understand, Mark, as we continue to experience COVID-19 and we start to make sure that we are messaging very effectively, we want West Virginians to know that we have made a tremendous amount of progress. We saw the video and the moves the governor has driven us to do have been moves that have helped West Virginia markedly save lives, reduce the spread of COVID-19. But it's really important to recognize, and that was really the comments that the governor made this morning and that I made as well, that we are not finished with this virus. And so for many people, I'm worried that they're starting to let their guard down a little bit. We know that the more people we vaccinate in these highly vulnerable groups, the aged, people over 70, people over 60, people over 50, which we know accounts for really almost all of our deaths, 97% of our deaths in our nursing home residents, 50% of our deaths. But we also know that other people can be at risk for severe disease and hospitalization, including in many of the medical pre-existing conditions that the governor has okayed for us to open up eligibility to. So as we are continuing to watch very closely, like you suggest, Mark, we know that now is not the time to drop our guard. We have opened up more of West Virginia, more to businesses, which is important, but we want to make sure that we're extra careful because we do see the spread of COVID-19 picking up around the world. And we know that the United States is a bit behind, but is not going to escape that, nor is West Virginia, that is always a few weeks behind bigger states like New York or Florida or Texas. So now is the time to really be careful. And the spread of this COVID variant, the United Kingdom variant, which we don't see very many cases yet in West Virginia, but we anticipate it's going to grow in the United States and in West Virginia. And this variant is more highly contagious and can be more deadly. So it's really important for us to really be careful right now. I'll turn it over to Jim Hoyer for the second part.
Yeah, and Mark, good question. So you'll still be tracked by the pharmacy, the Walgreens pharmacy that did your first dose. Remember, first and second doses are managed separately. So you'll still be tracked by them and should receive notice from them to come and get that. Important to understand that Walgreens didn't just pop out on their own with this. They're still Walgreens, Fruth, our other independents are still in coordination with us. But what we've asked them to do in this phase is to start to look at other populations that they have had lists for, or they have people. And one of the things that's important in this process is some people are not going to sign up centrally, and some people are still hesitant about the vaccine. But if they have a trusted pharmacist or a trusted physician that talks with them about this, and they're more likely to get that vaccine, that's more people that we get. And with these variants coming, as Clay and I have pointed out, and the governor's pointed out, we've got to get shots in arms, and that's part of our effort going forward.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I want to follow up on the first part of Mark's question, but more specifically about Hardee County, our red county. Do we know what is causing that? Is there anything specific we can point to? Any facilities, businesses? Do we know where this recent surge there is coming from? Thank you.
Maybe Dr. Amjad, could you add something to this and everything, or anyone on the panel?
Yes, Governor. Charles, we have seen an increase in several cases there. We do have some school outbreaks there, so we are tracking those, but some of it is also decrease in testing that we have in several of these counties, but we are monitoring that. But we have seen an uptick in some school outbreaks as well, also in Hardee County. Thanks.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. Thank you to Secretary Crouch for clarifying some of the numbers that of the Everbridge system, because there were some things that didn't add up very well in the last briefing. So thank you for the updated information. I do have a question about Everbridge, things that have been swirling around for quite some time around it. It seems like the system, while well-intentioned, just doesn't do or hasn't done what we've needed it to do. So a specific question about Everbridge is, can that system track not only who is in the system, who is 65 years in age and older, but whether those people have actually gotten a shot yet? Do we know who's in the system who've already gotten a shot? And conversely, do we know who's in the system that has not yet received the shot? And as far as the strategy of having people call in if they haven't been contacted, that seems contrary to the governor's well-discussed run to the fire mantra, that if we know there are 65-year-old people and older who are out there, and if we know they're the most vulnerable population because of their age, why are we not mounting an assault to contact them, either on the state level in conjunction with the counties, or the state taking the lead, because the county health departments where we're sending those lists to are already, by their own admission and by the state's admission, heavily overworked trying to get people vaccinated and tested. It just seems like we're not doing everything possible to reach that very vulnerable population.
Kenny, let me this is the governor, let me jump in on the tail end of the question, and then I'm going to defer to Secretary Crouch and General Hoyer as well. But Kenny, I hear you. I hear you loud and clear, and all of us, I'll promise you this, that, and I don't say this defensively at all, but to think that we're not trying every single thing that we have in our capabilities to try to reach out to those that are 65 years of age and older is a little unfair. But it is constructive from the standpoint that it just gives, at least me, it gives me the motivation to go back and double check and find a methodology that can maybe even do better than what we've already done. Now, what we've already done is fabulous. There's no question about that, but we need to always try to reach out and do better. And that's why I said just a minute ago, that 75% vaccination rate of our 65 and older is great if we can achieve that, but really and truly, if we could get 85 or 90%, it would even be so much better. Now, and so I'll absolutely take your advice and go back and check, and if there's a way to improve it, we'll be right after it. But anyway, Secretary, if you could answer the rest of it, I'd appreciate it.
Yes, sir, Governor, and thank you, Kenny. And we appreciate the focus on that population, as we've talked about over and over again, and the governor says over and over again, it's about age, age, age. I mentioned earlier we have just slightly over 7,000 individuals age 80 and over. At one time, I believe that number was down to 4,000 or a little below 4,000. So again, this is a living document from the standpoint of people continuously registering in the system. We're getting about 26,000 new individuals into the system weekly. So a lot of those are elderly individuals who are just now registering. We actually had someone about a week and a half ago that was 105 years old and called the hotline or COVID vaccine line that they had not been called yet. And when everybody got frantic, looking to see what had happened, and the birth date was wrong. Instead of 1916, it was 2016. So we have a lot of errors like that in there that as people call, we can dig into that record and see what the situation is. So to answer your question a little more specifically, that information is in there in terms of when they registered. All of the information they place in there is accessible by the folks at the county level. Let me first say that the reason that we implemented this system was really to take the thousands and thousands of phone calls to local health departments and local entities that they were getting when the governor announced the vaccination program in West Virginia. And they were inundated. And we now have over 390,000 individuals who have registered in the system who would have been calling folks at the local levels. They were calling health departments. The health departments were call the state. Others are saying call your pharmacy. So it's a complicated system, and we're getting about 70,000 needles in arms a week. And the number of complaints we get is relatively low to that number, but we want to go after every one of those. We want to go after age. And I was on a call last night with the local health officers in the state and directed them again in terms of priorities to focus their lists on these individuals. So again, Kenny, good question. We'll keep us focused on that. We're staying focused on that. The governor's telling us to stay focused on that, and we will get to those folks as quickly as we can.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Happy St. Patrick's Day. Governor, you get a pass because I saw you had a green tie on in the video. That'll work for today. Following up on my friend Kenny's point and Secretary Crouch and everyone on the panel, I know the emphasis on age. Has there been any consideration, like you have done with the African American community, and using the faith community to reach out to them? Could the faith community, the churches of West Virginia, help and make touch with these elderly people? They have a lot of credibility, and that's the right demographic to the people that are going to church these days. Is there anything going on along those lines, or is that an opportunity that may well work in the next few days? Thank you.
Well, I think maybe Clay, you could jump in, or Secretary Crouch jump in on this, but Paul, you make a really good point, and really and that's the great part about doing this. Kenny's brought this up before. We brought it up in all kinds of different ways, from pharmacies or the church community or the schools or whatever it may be, to try to reach out to those people, whether it be the African American community or the 65 plus of age and plus and everything. But really, what I did as soon as Kenny's question was over and we answered Kenny's question, I turned to my chief of staff right that second and I said, Chief, now listen, we got to go back and we got to go through this and find another way. We got to find another way to get at doing this, from the standpoint of being able to reach. And my very words were, I don't care if we got to drive up every hoo-hoo holla, to be able to get these shots in people's arms and everything, but literally we got to find a way. Now, and in addition to that, there's been ideas about the volunteer fire departments and and getting our local communities more involved in the vaccination process. As we have more and more vaccines, it is something, it is just great to have these briefings, listen to the questions, and then adapt and learn and everything. And so we're going to, we're sure going to try in every way to flip every rock again and make sure that there's not a way. And if there's a way, we're going to do it, but I don't know, Secretary, or if anybody else got anything to add. If you don't really have anything to add, let's go to another question.
Hey, Governor, if I could, to Paul's point, that Paul, we have been working with VOAD and the Council of Churches. And as I mentioned earlier, the governor tasked us to look at grandparents who were primary caregivers to children based on loss of a generation of parenting due to opioid addiction. So there is initiatives going on with churches, with volunteer organizations active in disasters. And we have had folks come to through those lines who they've asked, well, you're of the over 65, why haven't you registered? And they would say, well, we're just busy raising kids and we didn't know about it until you reached out. So those initiatives are going on. And as the governor pointed out, we're going to continue to press to get through those lists.
All right, thank you, Paul. Next to Kimberly Keggy with WSAZ.
Hi, good afternoon, everyone. I'd like to echo some of the similar questions that we've had this morning so far. I've talked to a lot of people and they feel like getting their COVID vaccine, just trying to get into the system and schedule that appointment is just as hard as hitting the lottery. And so are there any tips and tricks of trade for them to call and schedule? Dr. Bill Crouch, you mentioned, Secretary Crouch mentioned, if you've been registered in the system for more than 3 weeks and haven't got a call, to have people call. So is that a tip or a trick that we should be passing along to the public for them to be able to get their vaccine? Thank you.
Kimberly, let me just add one, have one comment, and then I'm going to pass to General Hoyer and Secretary Crouch. But let me just say this: if truly our people are struggling, on pre-registration or getting registered rather, and into the system, and have a level of frustration, we got to fix it. We just got to make it better. That's all there is to it. And just like we did way back when we were having all kinds of trouble and we felt like we had it, amply staffed up and going and everything, and I said, triple it. And then it still wasn't quite good enough, was it? And I said, triple the triple and everything, and then we got it. So everybody, all the experts that are on this call and everybody, if in fact we still have people out there, especially our elderly, that are trying to get, in the system and get everything moving to where they can get vaccinated, we just have to do better. I mean, that's all there is to it. We've done, and I commend all the great work that they've done and everything, and I'm really proud of what they've done. They've done amazing work, but evidently we can do better. And if we can do better, let's do better. But Secretary Crouch, maybe you can respond a little bit to the question, and then General Hoyer.
Yes, sir, Governor, and we will do better. One of the things I'm sitting here thinking is, as we get all of these questions aimed at this elderly population, is maybe we need to have our health departments set up a Save Your Wisdom clinic specifically for the elderly population in their counties, so that we get those numbers down even further. Again, some counties have done a great job. Part of this depends upon the percentage of the elderly population in the counties. It varies quite a bit more than most people think, but we've got to get to this population. These are the individuals who are hit the hardest from this. These are the individuals the governor has targeted from day one in terms of testing, in terms of immunizations, and we need to push a little harder on that. So I appreciate the questions. Again, my discussion last night with all of the local health officers across the state and directing them to focus on this group, we need to hit that a little harder. And I hear what you're saying and I hear what the governor's saying, and we'll do that. So thank you.
All right, thank you, Kimberly. Next to Evan Bevins with the Parkersburg News and Sentinel.
Yes, thank you. General Hoyer, you touched on this a little bit earlier, but I wondered if any of you could speak to the possible impact of Walgreens moving out of the Everbridge system. Will that have any impact on the amount of vaccines that are delivered, if they have to be split up at all, or just what the effects of that could be?
General, please do.
Yes, sir. Yes, sir, Governor. No, understand that Walgreens is part of the federal pharmacy program. So those are additional doses that come to the state. We still stay in coordination with Walgreens, but what was done here was to ask them, based on the opening of additional people with health risks and the critical workforce, we needed another parallel path to get to folks, and that was what this is about. So it has no impact on doses available or getting to those key populations.
All right, thank you, Evan. Next to Mark Cram with WDVM.
Good morning. Good to see all of you again. We obviously talked before about seeing a possible uptick as people went out and so forth. Governor, do you think perhaps it was opened too quickly, too much, too soon? Would you anticipate having to ramp that back? And then I know it's been mentioned several times by the doctors about making sure to get a test if you feel any symptoms at all, sore throats and so forth. For those individuals who are fully vaccinated, they've had both shots or they got the Johnson & Johnson, if they experience any of those symptoms, sore throats and so forth, are you also advising them to go get the COVID test? Thank you.
Mark, I'll take them both. I am advising them, if they develop, any kind of system, this free testing is just that. I mean, even anxiety, go get a test. I mean, for crying out loud, while it's there available to you, go get a test. I mean, what in the world can it hurt? And at the end of the day, if you were to test positive, we'll be ahead of the game. And so whether you've had, both vaccines or not, I don't think it matters. If you've got some concern about what's going on and everything, go get a test. And from the standpoint, Mark, of opening back up too soon, are we going to have to put additional restrictions back on and everything? In this situation, you have to manage it from a very fluid standpoint. You've got to be willing to move. You got to be willing to pull some things back if you have to and everything. But no, without any question, I absolutely believe with all in me, we have done the right thing about opening as much as we can back up. We absolutely did the right thing as far as telling everybody, we need to continue to wear a mask, and we did not relax that restriction. But at the same time, Mark, none of us know that absolutely this is without question the absolute right thing, because there is no playbook here. There is a pandemic here, is there not? And we're all having to deal with it the very best we possibly can. We've got to go on and live. We've got to have the engine of our economy running. We've got to go to work, and we've got to go to school, and we've got to have our lives to the very best of our abilities to have that. But between now and when this ends, we're going to have to continually be ready to adjust. And so we'll do that, Mark.
All right, thank you, Mark. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Carnegie Mellon University has put out a survey of vaccine hesitancy in which West Virginia ranks 20th among states with vaccine hesitancy, with 26% of those surveying saying they probably won't or definitely won't be vaccinated. How do we address this figure?
Let me answer it, guys. Phil, I have been, to be perfectly honest, just to take it on straightforward as I can be, if in the very beginning, we said there's going to be a vaccine come out someday, and it did come out, I'd bet you big bucks that if you'd polled all across this country, where would West Virginia be? There would be so many people that would believe outside of this country that West Virginians, especially more Republicans than Democrats, and West Virginians believing the way that they believe would probably be maybe even dead last, if not dead last, real close to dead last on the number of percentage of people that would take the vaccine. For us to be ranked 20th, to be perfectly honest, is pretty dadgum good. In fact, it's better than pretty good, considering, maybe the mindset of the West Virginia maybe of old in a lot of ways. Now, if we say just that and we say 20th is great but not good enough, what do we want to do? I come out here like I am every day. All the people around me come out the same way, and we tell people repeatedly that the exposure, the downside to taking this vaccine is nothing for all practical purposes. And absolutely the upside will save your life. And so we say it and say it and say it. Many of the people, even when we offered it to the teachers, a very professional, educated part of our society, there was a real reluctancy with a bunch of people there. And then just the same with our nursing homes. And then as they saw where we are today, many of them backed up and said, no, here's my arm. I want to get my shot too. And so we've made really good headway, but we want to keep at it, Phil, because, 20th is great, but it's not good enough. And so we can just keep trying to get everybody vaccinated if we can pull it off.
All right, thank you, Phil. Governor, I'll turn it back to you.
Okay, like I said, I watched that video at light speed on the way in here. I had some meetings earlier. This morning I met with the Senate President and the Speaker of the House, and then after that, I met with the Commissioner of Agriculture, and so we got a little bit behind and everything, but we're trying to deal with really important stuff, like I know we're dealing with each and every day all across this nation and everything. But I really, one of the people on my staff, said, Governor, have you seen this video? And I said, no, and they just kind of jammed it up in my face and everything, and I watched it kind of on the run over here. But I really didn't pay a lot of attention to it like I did when it just played. I ended by saying, and whoever put the video together, I think Kelsey put it together, and great job, Kelsey. But with all that, it ended by me saying, it's really been tough. That it's hard to think about that's been a year. And I watched that thing and I just thought, gracious goodness, all the things we've all been through and all the people that we've lost along the way and all the stuff that everybody's just worried about and agonized about, me included. And so I thank you for all of us, for pulling the rope together. It could have been so bad in West Virginia, so bad. And really and truly, it's ended awfully good, even though we have lost 2,565 great West Virginians. And the only other thing I want to say is, people do this out of habit a lot of times. But ask a question from the media and people say, thank you for that question. And really, they don't even know what they're saying a lot of times. They're just probably killing time to try to get their brain set to be able to answer the question. But you don't hear me say, thanks for the question, unless I really probably mean thanks for the question. But I can tell you this, that I love, a situation like today where, Kenny's brought this up a couple times. you know, even though we're setting back, we're really proud of the fact that we've gotten almost 60% of those people that are 65 and older tested in the state. We're really proud of that and everything, but really by Kenny bringing this up again stimulates a determination in my mind to say, no, hold on. I mean, there's no point in spending time being proud that we got 60%. And there's no point in really truly stopping at the hopes of being at 75%. He's right. And so all of us, we need to just catch another gear here, do we not? We need to try to find if there's a way beyond what we're doing to really get this done. So Kenny and Kimberly and Paul, because they were kind of following on one another and everything there, for me, thanks for the question and or questions. And so anyway, like I said, it's a tough anniversary of a year and everything, but please keep all those in your prayers that we lost, and hold on that rope and keep pulling, everybody, and we're almost to the end here. We're going to get there. Thanks a bunch to all of you. I love you with all my soul.